I think that's how you get started.
You are live.
All right, good morning. This is Senate Health and Welfare. It is January 12th. Hard to believe we're moving right along. And we're meeting a little bit early today. We're going to start talking about the bills that we would like to or are interested in, topics that we're interested in, and sort that out by bills. And Jen and Katie are both here to help us if we have any questions. And then
Just listen.
our brains behind the work, and then we'll come back to this. Hopefully we'll have some time today to finish it off a little bit. So I don't know. I'm thinking we each spend some time over the weekend looking at bills we'd like to hear about. So who would like to start?
I'm happy to get us started.
Go for it.
So just bills, or I think we had said like, what's your focus gonna be?
Yeah, no, that's fine. But I think if you can link it to some of the bills that are in our committee, that is helpful. We have this sheet that was online that Melissa gave us.
So generally, I just think we need to continue to focus on bringing the cost of healthcare in the state of Vermont down. Our education system keeps getting blamed for all of our ills, but the fact is that healthcare costs are one of the big issues when it comes to affordability in our state. I think many of us will agree on that. So that's number one. Number two, I think a lot of our bills are focused around getting care out of hospitals and into more local and less costly facilities. So I think that's important, really investing in primary care and getting some of the expensive care out of hospitals and into primary cares and birthing centers and PT and you name it. And then specifically, let's see, I have some bills that I hope we can focus on. One being the overtime nurse. I don't even know if I put it in yet, but
there is one in by, I think, Senator Bajowski.
Okay, well, banning mandatory overtime for nurses could be one of the ones I have here.
Okay.
We have the AI counseling, AI therapy, putting guardrails around AI therapy, which we know can be extremely dangerous. There's many horror stories about the effects of damaging AI therapy. What else? Those are the ones that are coming to mind, but I'm looking forward to taking up some of those bills that again will lower costs, which I think of as, the optometry bill and so on. So exciting. We have a lot to do in a short amount of time. So looking forward to digging in.
Okay. We are going to dig in.
Yeah. Thank you.
So who's next?
Go next. I mean, I just like Senator Garrett, I sort of focused at cost. And I kind of tried to look at three things, something that brings costs down or controls the rising costs, improves access, and also I feel, we need to support our rural healthcare facilities. And so I looked at those in my limited knowledge of what all these bills are focused on. And so I identified several that I thought would be good to dive into further. S64, which is the optometry piece. 76 and 77.
77 was what?
Is an act related to fiscal year 2025 appropriations from the
Is that the opioid? Right past that one.
Oh, okay.
Yeah, that's good. And that's the
Alright.
one that we, remember we were talking with Katie a little bit about the opioid settlement program. We'll see another bill related to that. Either coming from the House or integrated into the budget.
There's an S-77 up there that's,
It's still there because what happens is that if there's a bill here and then the same bill in the House. This time it started in the House and starts in the House because it has an appropriation in it. So that's all.
okay,
It's the same thing, but a good shout out for that because that is one we're looking for from the House.
Okay, and then I had 166. I wanted to know more about 190.
$190 and
166. That's just
immunization recommendation.
They're working on it in the House. There were companion bills.
what's the name of the bill?
Immunization recommendations.
Oh, right, and that's starting first in the House. Just so there are somebody, but this is good. I'm glad you've identified it because we're gonna be seeing it. Hopefully.
That was kind of my list.
Okay. Who's next?
I don't think anyone's gonna like it, but.
It doesn't matter whether we like it or not. It's-
I'm hearing quite a bit of it. Back home is S-21, the cell phone free schools.
Oh, but we did that.
Oh, okay.
We did it last year, so that's good. I mean, all of those that we had up there from last year and that got picked up. Katie, was it in education?
Wasn't me. It must have been Beth.
Okay.
Went into the education.
Beth did it, and so they did it.
Some of it went into.
That night in my mind, I questioned, is that a healthcare issue or is that an education issue? I guess you could argue both, but
Mhm.
that's why I didn't certainly.
That's okay. It's good to know. Because if something comes up related to it, we can pick it up.
That's
And then the only other one that really intrigues me is the one Senator Benson discussed, and that's S-90. Which is agreement on care what reference-based pricing.
190, yep.
I think I would like to look into that more.
Okay,
And those are the two that I guess I'll need to worry about. S-21, although that'll be. If it's passed out of here, you got the sister bill in the House, is it passed out of their committee?
it's all done. It's in law.
Oh,
Yeah, it's in law.
okay, so why isn't it?
Well, because we didn't, okay, let's go back here. Okay, those are the bills in our committee. If we pick a bill off the wall and we act on it, it moves over to the other side. If we do nothing with it, it stays on.
Okay,
If the House has the same bill, they do the similar. But ours just stays where it is.
Yeah.
Yeah, so
because it's been passed.
it's gone. And what we should do, what we've done in the past is just take a little check and put an X on it, meaning that it's been incorporated into another bill or in the budget. Yeah,
Okay,
yeah, it gets confusing or could.
so those are the two I was interested in, but that's
Okay.
90. I'm curious about
All right,
reference-based pricing.
okay. Well, I'll go through and then we'll hear from Senator Cummings when she gets in. We'll try to have Jen and Katie come in and talk about some of the bills. Obviously, I've been talking about the bills that I'm interested in from the beginning, and I will continue to do that. But I went through and I thought, cost, access, quality, those are the things that are so critically important to us. Workforce development and support is important to us. Aligning insurance payments to make sure that we have equitable reimbursements, and that will help patients with access. And then, I think also looking at what we did last session and if there are some fixes that we can make that might help along the way. So I used sort of that level of filter. And I have a huge list of bills. As you can imagine, I'm probably familiar with some of them more than others, but the top of my list are the primary care bill, S-197. The recovery residence bill, S-157, which, by the way, the, administration has made some recommendations, and I'm gonna send those along to Katie so she can look at them. And then we owe it to both the House and the, advocates for the, prescribing by PhD psychiatrists. Those are some starter bills, but I, and the optometry bill we will pick up, sooner or later. Then there are a number that I think are important to us to pick from 2025. And that includes the, dyes in foods and educational institutions. That's, we also should look at, some of the others like hospital salaries for administration. I think those things have started to be taken care of as hospitals have done the work towards transformation. They're making their own decisions. I think it's hard for us to, dive into individual hospital decisions. And then similarly then with, Senator Buick's concern about banning overtime for nurses, I think that is a really worthwhile discussion. And we could look at that as well with the all affects workforce. So I have this long list. I want to look at the APRN in hospitals. That's also workforce. There are some bills that have been brought to us by Green Mountain Care Board or with respect to governance, S-188, for example, put that in. And then outsourcing care and reference-based pricing, S-190, which you have mentioned, and I'm glad you've mentioned it because that's an important bill for us to look at. And there are others. So I think what we'll do is we'll make a list. We won't go through S-77 because we already did that last year. And we won't do the cell phone school S-21 because we've done that. But we'll pick up the other bills that you're interested in, and we'll have Jen and Katie come in and do we have what are known as 50,000 foot, 10,000 foot, and 1 foot level. We don't go 1 foot right now, but we will go 50,000 feet and 10,000 feet and look at the bills just so we understand what it is we're asking to look at. Yes, ma'am.
There's one other bill I wanted to mention.
Go for it.
It's not currently here. I hope it eventually gets here, but it is the ban on paraquat, which is a herbicide that is directly linked to Parkinson's disease and also lymphoma, but really Parkinson's disease. And it is a health issue for sure. And I do hope that it makes its way into our community at some point.
Is it right now? It's in agriculture. So I'll talk with Senator Ingalls and maybe we can take a look at that one as well. That'd be good. And there's a bill in natural resources that also has chemicals that cause health problems. So we'll do a run through that one at some point. DEHP is the one we're interested in. Oh,
And can I just add that paraquat is banned in over 70 countries, including the 3 that manufacture it: China, Switzerland, and Great Britain. So, yeah,
like they're making money in the US.
yeah, but we're making people sick.
Yeah, no. So I will tell you, I have listed, the International Physician Bill, S-142. A lot of work has been going on in the southern part of the state on that bill. A lot of folks looking at what kind of requirements would need to be in place to have physicians who have studied outside of the country and now reside in the country and have them practice medicine in Vermont. That's the bill is the 2025 bill, but I've been in communication with folks down in the Brattleboro area and they've been working hard on that. So we'll look at it. It could help, with workforce access. Met recovery residents, PhD, dies, I mentioned. I'm curious about the gender ID on the birth certificate and what that means, for the Department of Health. Then I mentioned the next two, health equity data. Should look at that because there are very distinct differences between, ethnic groups with respect to their health needs. And so looking at how that data is collected and how it is utilized, in clinically might be helpful. Department of Health is doing that work. We have a bill from Viva, Medicaid, for their technical corrections, 162. I mentioned the APRN bill. There's a governance bill from, Green Mountain Care Board, 188. And then 189 also from the board, and it's something we've been interested in here. And that is, when a hospital makes a decision to cut a service or add a service. This goes into the regional issue, the rural health that you guys were talking about, we've all been talking about. But when a hospital makes that decision to add or subtract, then what criteria are used, and how does it fit into the budget decisions at the board level? So there is a bill on that. The recommendations have come pretty much from the Green Mountain Care Board, but we may want to talk about that and hear from hospitals and hear what the transformation work is that's going on. That'll help us. S-190 that you picked out, which is the outsourcing of care, is pretty important, from my perspective, at least. If you're going to outsource whole emergency department or other service, we want to know what are the guidelines, what's the contract look like, what revenue losses are a result of that, and that's where we need to get Nolan in to talk about provider taxes, because we may lose provider taxes there. Then there's a little tiny bill on the payment for designated agencies. I have a meeting with the administration about that. This is a controversial bill. It's also a controversial issue, but it's something that we ought to look at and provide oversight on how our designated agencies are reimbursed or paid up front. And then my favorite bill, primary care. And then one that no one has mentioned, which is the early childhood licensure bill, which is important to the professionals who are providing childcare in our state. So that's a short list of mine. And they do, there's a lot of linkage. We have a lot of linkage, and I think as we go through those bills, maybe we'll find some things we can pick out of one and put into another. Do our own things. Any other thoughts that you have? So as you learn more, as we look at the bills and you become more sort of familiar with the whole area that we're in, then you'll find other ones that you like,
I'm sure. Typically, other committees I've been in, the administration tries to put forth some form of bill of some kind. Does that happen here in this committee as well? Have they,
But we don't have the administration's bill in here yet. I met with them pre-session, and they did say they had a bill that I think Senator Beck is putting in. I think Representative McCoy has put the same bill in the House, and so I'll be having that dialogue.
I was wondering, something like that.
Oh, yeah. And there's some things in there that we'll have to wrestle with. I mean, we'll see how much is palatable for all of us. Make sure we know what's there.
In the House, it's not, I mean, may come from the House to the Senate, but there's not a Senate version. There's not a Senate version.
Not yet.
The administration.
Oh, there isn't. Okay, so, then,
H 585 is in it.
okay, they must have decided after we had the conversation. Okay, good. All right, anything else? So some of these bills, I'm hoping are less difficult, and I mean that by less complex and perhaps a little easier for us to begin with, so I'll try and put some of those in first. Some of the bills have already been worked over pretty well in the House, for example, the PhD psych prescription prescribing. We'll probably put that one up right away. And Popper actually, our Representative McFawn did come in and present that bill to us last spring, but I'm gonna invite him in again anyway. And we'll be good. And then the recovery residents will pick that one up because it is really important. These are all what's in most of these bills are really important for moving ahead in the areas that we're interested in. Katie or Jen, do you want to add anything?
We took care of your notes.
But
We'll need some clarifications on which bills you want us to be walking through there. So we can talk about.
Yeah, we'll do that. I'm glad to. And I think I sent Callista a couple line and I'll add, I think we might add SY 90 in there. We're gonna have the Green Mountain Cure Board in and Department of Financial Regulation in just to understand their role. And that'll be important for this. So we'll add that one. What's 166 again?
Organization.
Huh?
Immunization.
Oh, yeah, that one's in the House. Right, that's in the House. And then the rural health, we're going to hear about the rural health transformation grant tomorrow.
I wanted to ask a question about that
Sure.
or make a comment.
Whatever.
I'm excited to talk about the grant, but I was hoping that we could also get at the same time, or maybe beforehand, what's been cut, right? I know we're gonna be getting something, but I think something has been taken away also, and I'm wondering if we can talk about what's been taken away so that we have better context for what. we're
Right,
getting.
so that was the testimony that we heard.
Yep.
And then we'll have folks come back in to reinforce that.
Yeah.
About what's happened with that bill that was passed on July 1st.
Yes,
And the loss of Medicaid and,
Yeah.
or the work requirements and the 60-day renewal of all of.
yeah. Will we be able to see actual numbers?
Sure, well, then we can ask for those,
Okay.
it's difficult
Yeah,
prediction wise, and we also will want to know how many people have not signed up for QH quality or health plans. And so that will come forward as well. It's hard, we can't cover everything.
right.
I mean, money wise, $65 million is a big chunk, and we're also looking at $75 million more or less for education. And then if that becomes an ongoing commitment after we do that, then we have a lot of questions in there. Yeah. Sure, yes, the answer to your question, yeah.
Okay, thank you.
Right.
I think I just read the bill.
Yeah, so we're good. And we'll come back after the floor if we have time. A couple of folks are scheduled to come in. And I will also say real briefly, I do plan to have the hospitals in and to talk about what they've been doing as a result of transformation. It's a lot of work. And it's really great to see. Okay,